This is me Arju here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. And this is our part 3 video of the dentin, and in this video we will be discussing with the contents of dentinal tubules and the dentinal fluid, the theory of pain transmissions through the dentin, similarly age and functional changes, and we will be discussing with the different dentinal junctions. Okay, so this is the last video of the dentin series. Okay, and in my previous videos of the dentin I have covered all those important topics of the dentin that are quite asked in a university level examination. Okay, so from today's video the important question that can be asked in your exam is the theories of pain transmission. So without delaying much, let's get started. So our first topic is content of dentinal tubules and the dentinal fluid. Okay, so in contents of dentinal fluid, dentinal tubule, okay, so cytoplasmic extension of the odontoblast bath in a tissue fluid, that is a dentinal fluid. Okay, similarly microfilament vesicles and the ribosomes are present in dentinal tubules, and periodontoblastic space contain the dentinal fluid. Efferent nerve fibers may extend to the short distance. Okay, I would simplify this all 4 points. Okay, so all those 4 points include all those important things that are to be studied in this topic. So what they are saying is, so in the dentinal tubules, as I have discussed in my previous video, okay, so dentinal tubules are like this. Okay, so they are tapered structure. Okay, so they are tapered structure and which have larger diameter towards the pulp and smaller diameter towards the dentino-enamel junction. Okay, so now what happened is that, okay, so here is a odontoblastic process. Okay, so from odontoblastic process there arise a odontoblastic process. So this is odontoblast and the odontoblastic process arise from the odontoblast. Clear? Now what happens is that, okay, so cytoplasmic extension, this is, okay, is present in the dentinal tubule, and in this dentinal tubule, okay, so in this dentinal tubule there is a presence of the dentinal fluid. Okay, so there is a presence of a dentinal fluid that I have discussed in my previous video. So this dentinal fluid is just present in that periodontoblastic space. Okay, periodontoblastic space is a space that is remaining after the space that is occupied by the odontoblastic process in the dentinal tubule, in the lumen of the dentinal tubule. Okay, so there is a dentinal fluid present there. Similarly, okay, and microfilament vesicles and ribosomes are present there. Okay, so this odontoblastic process are itself made from the microfilaments and different kinds of intermediate filaments. Okay, so they are present in this peridentinal tubules lumen. Okay, after that efferent nerve fiber may extend to the short distance. So this is very important. Okay, so efferent nerve fiber, okay, so efferent nerve fiber, it arises from, okay, so when I will be discussing with the pulp, okay, so in pulp chapter I will be discussing with their different zones of the pulp. So there is a cell free zone. Okay, so there is a cell free zone in the pulp. Okay, so that contains the, okay, so it contains, this is a cell free zone. Cell free zone is present in the pulp, and in cell free zone there is a presence of the subodontoblastic plexus. Okay, so there is a plexus of the nerve that is called subodontoblastic plexus of the Rasco. Okay, so from that plexus the nerves get arise. Okay, so the nerve fiber that arises from that plexus, and that plexus nerves, okay, so the nerve that arise from that plexus get entered into the dentinal tubule up to the certain distance. Okay, so up to the certain distance it is present, it is not present throughout the dentinal tubule. Okay, so I have written about this here in at the last. Okay, so innervation of the dentin. So in innervation of dentin, so nerve fiber accompany about 30 to 70% of the odontoblastic process and are referred as an intratubular nerve. Okay, so the nerve that is present inside the tubule is called intratubular nerve. After that I have written here, tubules contain numerous nerve endings in predentin and inner dentin no farther than 100 to 150 micrometer from the pulp. Okay, so as I have discussed in this picture, okay, so this is a nerve fiber. Okay, so this is a nerve fiber. When it enters into the dentinal tubule, okay, so it traverse the distance of 100 to 150 micrometer just. Okay, so just 100 to 150 micrometer distance it is traveled by the intratubular nerve. Okay, here similarly after that I have written here, there is a close association present between the process and the nerve fiber. Okay, so there are presence of different kind of synapses. Okay, and different kind of connections are present between the odontoblastic process and the nerve fiber that I will be discussing. Okay, so it have this statement have significance in this. Okay, when I will be discussing with this transduction theory. Okay, so there is the significance of that point. Okay, Now in another point I have written this. Okay, so this point is not so important, but as I have found this point in book, okay, so I thought to include in the note, so it would be better. So as I have written here, it is the primary efferent somatosensory nerve of the dentin, and the pulp project to, okay, it project to the descending trigeminal nuclear complex, that is subnucleus caudalis. Okay, so it is not important to remember, but also if you want to, then you can remember it. Okay, so after that, okay, so we were here in the contents of the dentinal tubule. Okay, so now in the dentinal fluid and the dentinal lymph section, okay, so also dentinal fluid is called dentinal lymph. Okay, so this is MCQ, so they can ask you in a viva also, or also in a different kind of the MCQ exam, there you should tell this. After that, dentinal fluid is the ultrafiltrate of the fluid of the pulp capillaries. Okay, so in pulp, okay, so if this is a pulp, okay, so if there is a, okay, so I will draw with the red. Okay, so if this is a pulp, okay, so if this is a pulp, okay, so if this is a pulp, then, okay, so this pulp, okay, so there is a, in pulp capillaries, okay, so this is a pulp capillary, so there is a exchange of the gases here. Okay, so there is a exchange of the gases, and the filtrate that is that is released from this pulp capillaries. Okay, so those ultrafiltrates are the dentinal fluid or the dentinal lymph. So that is written here, this is ultrafiltrate of the fluid of the pulp capillaries that is higher in the potassium level and lower in the sodium level. So this is important here, you should remember this. Okay, so it is the ultrafiltrate of the pulp capillary fluid that contains the higher concentration of the potassium and the lower concentration of the sodium. After that, I have written here the composition is similar to that of the plasma. Okay, so when you have studied the general physiology, so during the exchange, okay, so at the capillaries there is a just a release out and the release in of the plasma. Okay, the cells of the cell portion of the blood, okay, that doesn't go out from the capillary, just the thing that goes out is plasma. Okay, the contents of plasma, so you can remember like that. Okay, so composition is similar to that of the plasma. A pressure gradient exists between the pulp and the oral cavity, the fluid tends to flow outward. Okay, so this is important here. Okay, so as I have told here, the odontoblastic process, it is arising from the odontoblast and is entering into the dentinal tubule. So the dentinal fluid, so the pressure inside this tube, okay, so it is higher towards the pulpal side and lower towards the dentino-enamel side. Okay, so that the dentinal fluid tends to move outward. Okay, and I have written here tissue pressure of the pulp is, okay, 14 centimeter of H2O. Okay, so 14 centimeter of H2O pressure is present here. Okay, after that, 2 to 3 times more calcium content is present in the predentin. Okay, in the, okay, in predentin. Okay, so what it is telling us that there is 2 to 3 times more calcium content. Okay, so if this is a odontoblast, so the dentin layer that is just adjacent to the pulp is a predentin. Okay, as I have discussed in my previous video, I have told there it is a unmineralized matrix layer. Okay, it is a unmineralized matrix layer of the dentin. So from that point, okay, so the dentinal tubule is present in the dentinal predentin too. Okay, so the dentinal fluid that is present in the dentinal tubule of the predentin contains the 2 to 3 times more calcium. Okay, so that I have written here. After that, our important topic of today's video, that is the theories of pen transmission. Okay, so for this content of the dentinal tubule, I have one picture, I will show you that. Okay, so once look this, so this is a enamel. Okay, so this outer layer is a enamel, this is a dentin-enamel junction, and I have done mistake here. The mistake is this. Okay, so the dentin-enamel junction is scalloped. Okay, and the concavity is towards the enamel and convexity is towards the dentinal side, and this is a pulp and dentin junction. So this is odontoblast, this is odontoblast, and the process that is arising from the odontoblast is a odontoblastic processes, and these are the nerve fiber. Okay, and this is a subodontoblastic plexus of the rasco, and this is a nerve fiber that is arising from the subodontoblastic plexuses of the rasco. Now after that, we can see the dentinal fluid in the periodontoblastic spaces. Okay, so from this diagram we can clear the, you can have the overview of this contents of the dentinal tubule. After that, the theories of pen transmission. So in theories of brain transmission, we have three important theories. Okay, so these theories, okay, so they are just theories. Okay, so they are not proved yet. There is a proper evidence, okay, that can tell that how the dentinal sensitivity or dentinal pain transmission happens. Okay, so there is no any kind of evidence based study done on this. Okay, it hasn't been proved yet, but there are many theories present on this brain transmission. So our first theory is the direct neural stimulation theory. It was common theory in previous times. Okay, so in 1963, Scott and Stella, okay, Scott Stella proposed this direct neural stimulation theory. Nerve endings in the tubules are directly activated by the external stimuli. Okay, after that, nerve do not extend beyond the inner dentin. And the drawbacks are topical application of the local anesthesia do not abolish the sensitivity. So first I will explain these 3 points. Okay, so what they are just thing. Okay, so direct neural stimulation theory means it is a theory that tells you that, okay, as in this picture, okay, as I have shown here, this is a dentinal tubule and there is a presence of the dentinal nerves that is arising from the subodontoblastic plexus of the rasco. So that this theory just tell us that the sensation or the pain that is carried in this dentinal tubule is by the nerve fibers. Okay, so it is by the nerve fiber. So this much this theory tells us, but there are many drawbacks. Okay, so you can think that, as I have told earlier, the nerve fiber are not present throughout the dentinal tubule, so that how can you say that pain transmitted in this outer portion of the dentinal tubule? You can't say that. So that is one drawback of this theory. Similarly, our another is, okay, sensitivity at the dentinal junction is not explained. Okay, it also can't explain the sensitivity in a newly erupted tooth at much. Okay, so as also in a newly erupted tooth there is not proper development of the nerve fiber, so how can you say that there is a proper sensitivity? Okay, so in the newly erupted tooth, but sensitivity happen in those tooth too. Okay, so this is the drawbacks of the direct neural stimulation theory. So just you remember is that nerve fiber transmit the pain sensation in the dentinal tubule. This theory tells that much only, and the drawbacks are here. After that, in transduction theory, okay, so in the transduction theory, odontoblastic processes are the primary structure to be excited and then impulses transmitted to the nerve endings. So okay, so simple thing that it is that is wants to explain us that. So just think, this is a odontoblastic process. Okay, so as in a direct neural stimulation theory, as the nerve is not present throughout the dentinal tubule, it is just present in the inner dentin, so you can say that nerve can transfer the impulse throughout the dentinal tubule. But in transduction theory, what they tell us that is odontoblastic processes are those, okay, that transmit the impulses throughout the dentinal tubule, and they are connected to this nerve fiber by the synaptic connection. Okay, so there are presence of the synaptic connection present there. Okay, so there is a synaptic connection present between the odontoblastic process and the nerve fiber. So the impulses that is present in this dentinal tubule get transformed from that synaptic connection to the subodontoblastic plexus of the rasco. Okay, so okay, now in our another point, it is supported by the evidence that odontoblasts have developed from the neural cell cell. Also there is a presence of, okay, so the supporting point for this theory is that, okay, so odontoblasts have been developed from the neural cell. Okay, so we can say that it would have been transferring the impulses. And also acetylcholinesterase enzyme is present near the body. Okay, so these 2 points you should remember, it is very important, acetylcholinesterase enzyme and neural crest cell origin. Okay, so these 2 points supports this transduction theory. And the drawbacks of transduction theory is that there is no any such synaptic connection present. Okay, so some people, the people that are supporting this theory would tell us that there is a presence of the synaptic connection, and some group of people say that there is no presence of any kind of the synaptic connection in between the odontoblastic process and the nerve fiber. So that is one of the drawback of this transduction theory. After that, the main drawback, okay, so this is very important, it is proved also, the membrane potential is very low to permit conduction. Okay, so as I have told in this theory, as I have not told, but the theory wants to tell us that odontoblastic process transmit the impulses. Okay, but when the study was done on this theory, it was found out that the membrane potential, okay, so the membrane potential of this transduction theory was very low. Okay, so as the membrane potential is very low, it can't conduct the impulses. Okay, and if it can't conduct the impulses, it wouldn't transfer the impulse to the nerve fiber. So it is one of the drawback of the transduction theory. After that, the nerve is present in an association can either be afferent or the efferent. Okay, so you can say only just there is presence of the afferent nerve fiber. Okay, there may be presence of the efferent fiber. Okay, so that is one of the drawback of the transduction theory. After that, another theory is a hydrodynamic theory, and it is the most accepted and the most popular theory of the pain transmission and hypersensitivity in the dental. The brainstorm and the Gaisi proposed it. Okay, and the various stimuli like the heat, cold, air, mechanical pressure causes the movement of the fluid within the tubule that activate the free nerve endings associated with the odontoblast. Okay, so just you said think here. Okay, so those name in those nerve ending act like a mechanism. So I mean to say is that, okay, so this theory, just you make overview of this theory. Okay, so this theory tells you that in the dentinal fluid, okay, okay, so there is a high potassium and a sodium in this dentinal fluid that is present in the dentinal tubule. So those dentinal fluid are responsible for the pain transmission. Okay, so there is a movement of the dentinal fluid in this dentinal tubule that causes the pain transmission. Okay, so that is a simple overview of this theory. Okay, and the movement of that dentinal fluid would cause the impulse to transmit through the dentinal tubule and transfer it to the nerve fiber that is present in the dentinal tubule by the presence of the synapse. Okay, so through the synapse they just transmit the impulses to the nerve fiber. Okay, so this is a just simple overview of this hydrodynamic theory, and that seems like it is quite true. Okay, so as there is a presence of the dentinal fluid, okay, so there is presence of the movement of the dentinal fluid in the dentinal tubules. Okay, so it may be helping in the transmission of the pain. Okay, so it is quite accepted theory. Okay, so I have written here 2 points, so it can be asked in sometime in MCQ. Okay, so dehydration, cold, and the osmotic solution. Okay, so these three type of stimuli would cause the movement of the fluid away. Okay, and the hot type of stimuli would cause the movement of the fluid towards the dentinal tubule. Okay, so towards the pulpal side. Okay, so the note, I have written one note, so you can remember this: histamine and the bradykinin do not produce the pain in the dentin, unlike it do in the other tissue of the body. Okay, so as we have studied in the general pathology, so in the general pathology you may have been heard about this, or in a general physiology. Okay, so histamine and the bradykinin are those two neurotransmitters. Okay, are those two chemicals that would cause the pain. Okay, so they causes the pain in the other normal tissues, okay, of our body, but in dentin they are not responsible for the pain transmission. So now in age and the functional changes, so our first point is increase in the sclerotic dentin. Okay, so as I have discussed in my previous video about the sclerotic dentin and the dead tracts. Okay, so it is also called the translucent dentin. Okay, so you can refer to my second part of this dentinal, okay, dentin series. Okay, so there I have discussed about this sclerotic dentin in detail. So there is increase in sclerotic dentin at the apical third. Okay, mostly it is more increased. Okay, mostly it is increased at the apical third, but overall throughout the dentin it is increased. Similarly, in our another point, increase in the number of the dead tracts. Okay, so as the sclerotic dentin increases, there is also increase in the number of the dead tracts. There is increase in the peritubular dentin. Okay, so peritubular dentin increases. Okay, so how it is increased is that, okay, so when there is increase in the age, okay, so with the age there is a calcification. Okay, so there is a calcification and a mineralization. So there is increase in a mineralization and a calcification, due to which as I have discussed in a peritubular dentin, it is a calcified tissue that is surrounding the dentinal tubule, forming the wall of the dentinal tubule, so that if mineralization is increased, the peritubular dentin would also increase. After that, in another point, there is decrease in a dentinal permeability. So if there is a high mineralization, high calcification, that would decrease the dentinal permeability. After that, color of the dentin becomes darker with the advancing age. Okay, so with the age there is a decrease in a so there is a darker appearance of the dentin. After that, increase in the hardness of the dentin, that is primarily due to the increase in the mineral content. So this is quite similar to that of the peritubular dentin. Okay, so hardness is increased because there is an increase in the mineral content. After that, decrease in a dentinal sensitivity. Okay, so there is decrease in a dentinal sensitivity. So mineral component occupies the dentin most. So the dentinal fluid that is present in the dentinal tubule, the lumen of the dentinal tubule, it becomes less. Okay, so that there is a less presence of the this dentinal fluid, so that there is decrease in the dentinal sensitivity. After that, reparative dentin is formed. Okay, so this reparative dentin formation, there are two types of dentin, as I have discussed in my first part of the video, first video of this dentin. So there I have discussed properly about this reparative dentin and the reactionary dentin. Okay, so we have completed this age and functional changes. So the things that I have included in this note are more than enough. Okay, after that, our fourth topic is dentinal junction. Okay, so in dentinal junction, it is just short topic. So dentinal-enamel junction, as I have discussed in the enamel, it is similar like that. Okay, so it is similar. So it is scalloped or repeated with a concavity towards the enamel, convexity is towards the dentin. So this is very important. Okay, if you don't want to, if you have lost out, okay, in this dentinal enamel junction in exam, you don't remember anything about this. Okay, but you should remember this point. Okay, so the concavity is toward the enamel, convexity is toward the dentin, and it is scalloped. Okay, so this is a master point of this dentinal enamel junction. After that, the dentinocementum junction. So in dentinocementum junction, it is a smooth line. Okay, it is a smooth line junction between the dentin and the cementum in the permanent tooth, and in this justice it can be sometimes scalloped. Okay, so form attachment is present. Okay, so dentinocementum junction. Okay, so dentinocementum junction, as I have discussed in my previous video. Okay, so in these photos, okay, so as I have told and in my second video, so this is a dentinoenamel junction. Okay, and it is scalloped, but this is a dentinocementum junction and it is not scalloped, it is a straight. Okay, so the smooth line junction between the dentin and the cementum is in the permanent teeth. Okay, and this point is important to remember here. In deciduous teeth, it is sometimes scalloped and form attachment is present. Okay, so it is bit similar with that of the dentinoenamel junction, unless it is a smooth line junction, but also there is a form attachment present between the cementum and the dentin. The predentin and the pulp junction, so it is made of the collagenous fiber and it is present between the uncalcified dentin, that is predentin, and the pulp. Okay, so as I have discussed, first of all there is pulp, after the pulp there is a predentin, and after the predentin there is a dentin. Okay, so every dentin that is formed, okay, must have gone through this predentin. Okay, so predentin is just the dentinal layer that is adjacent to the pulp, that is unmineralized matrix. Okay, and when the mineralization happens, that mineralized predentin becomes the proper dentin and new unmineralized matrix layer is formed, and that is predentin. So it is always constant, so you should remember that. And the junction between this predentin and the pulp, this junction is called predentin and the pulp junction, and it is made up of the collagenous fiber and is present between the uncalcified this. Okay, so you should remember this collagenous fibers are present there. Okay, and after that, in dentin and the predentin junction, it is between the calcified dentin and the uncalcified newly formed dentin. Okay, and this innervation of dentin I have discussed earlierly in the first topic. Okay, first subtopic of today's video, that is content of the dentinal tubule. So I have completed all those important topic from this chapter, the dentin. So the topic that I have discussed in this all three videos of the dentin are very important for your university level examination. Okay, so you can't omit or you can't leave that. Okay, so I think this is more than enough when you will go through all those videos. Okay, and after watching the videos, okay, if you don't understand the video for one time, you can watch again. Okay, so you can watch in a 2x, so you can watch the videos in 2x. Okay, while watching the video you can revise. Okay, just before the exam, when you will watch this video, you can revise all your topics. Okay, but I suggest you that after watching the video, okay, you can go through the notes that I used to post in a telegram. So just study those notes. Okay, so I discuss with all those every points that I have included in my notes. Okay, so I discuss with all those points in my note, and when you will understand all those points from the video, and after when you will study the notes, okay, so you can relate easily. And also one thing that is important during studying any chapter is that when you will just watch the part 3 video of the dentin, I also suggest to watch the part 2 or the part 1. Okay, either you watch all the parts of the this chapter so that you can read it, or it is worthless watching only just one video. Okay, so watch all those parts of the any topic. Okay, so it would be easy, but as you wish, how you feel comfortable, you can study in such a pattern. Okay, it is upon you. So this much for today. I will catch you in the next video. Till then, stay happy, stay healthy, and study hard. Tata, bye bye, thank you.